Dr. Lily Nightingale, you had a very important Official Information Act request to the government under Jacinda Ardern, and that was made early on in the COVID-19 response rollout under that Labour government. What was your request for information, and what was the response to it?
So, whenever Pfizer released the documentation that it had sought to keep under wraps for 75 years, there were nine A4 pages of side effects. And I was very curious to know what the Ministry of Health knew because they were saying the word safe and effective. So, I was very curious to know, did they know any of these side effects? And if so, when? So, I submitted an OIA asking when did they know any of the side effects, when did they know some of the side effects, and when did they know all of the side effects? Did they know any before the mandates? Did they know any before the mass rollout? Did they know any before the children were invited? And so they responded that this information was already answered. And they gave me a list of links that I could follow to go and read myself to find it. They didn't make it easy because I don't think they probably wanted the information known. So I followed the various links, and all of those previous OIAs were anonymized, redacted. So I fell upon the one that answered my questions. And it turned out that they knew all nine A4 pages of side effects before one vaccine was given in this country.
Wow. So at what stage did you find this out? This is absolutely mind-boggling.
So I found that out March last year. That's because that's when I submitted my request. But they knew all nine A4 pages of side effects before one vaccine started in this country.
So when you put in that initial request for information, they said what? It had already been answered to somebody else.
Yes.
And where had that information gone, Dr. Lily?
I don't know what that person did with that information, but as soon as I knew of this, a friend of mine who is a writer, he then writes, writes under Kiwi for Justice, and he then did some writing highlighting that that this was inappropriate.
So what's fascinating about this is in response to your Official Information Act request, you were never given a transparent answer, but you were given a lot of links. And you yourself, with your medical background and determination, decided to investigate those links. Is that how you came to the final answer?
Yes, I had to click through the links to find this and read through the OIAs that were there until I found the answer.
And was there one clear document that said, yes, we are aware of the Pfizer 9 pages of adverse reactions, Lily?
Yes, they said that they had all of that information just in a different format.
Do you know what date they had it?
I've no idea.
How do we know that it was before the rollout of the COVID response?
Because they said that they had all of that data whenever it went to MedSafe.
What was your feeling as a doctor realizing that?
I was gobsmacked because all I'd been hearing was safe and effective, and 9 pages of side effects is not what I would correlate with safe and effective.
Where do you think this information should go now? How do you think it fits in with what Barry Young has done?
This went before Barry, and so therefore they had foreknowledge. So I believe that now questions need to be answered, people need to speak and explain how this was deemed safe and effective.
I think you're right, Dr. Lily. It shores up the public cry that is growing every day now. Release the information that you have, Ministry of Health. Release the information that Barry Young put out there. It is anonymized. The people of New Zealand need to see it. And I would say now we need to add in your information. Thank you for being willing to speak on this.
Thank you.